This is Flogam, a specialized therapeutic formulation manufactured by Sun Pharma. Clinicians typically prescribe this medication to resolve two distinctly different biological problems at once: systemic indigestion and localized tissue inflammation. To achieve this dual action, the pill relies on a three-part chemical payload: 48 milligrams of trypsin, 90 milligrams of bromelain, and 100 milligrams of rudoside. Combined into a single dose, they target the biological drivers of tissue damage and digestive inefficiency simultaneously. But looking closely at the core chemical nature of the first two active ingredients, trypsin and bromelain, presents an immediate pharmacological problem. Both of these compounds are structurally classified as proteins. The human stomach is an environment of highly concentrated acid, biologically engineered to dismantle and dissolve complex dietary proteins. If a patient swallows this tablet orally, those active protein-based enzymes should theoretically be completely destroyed by gastric acid, long before they ever reach an inflamed joint or swollen tissue. To understand how Flogam actually works, we have to look past the biochemical components themselves and examine the specialized mechanical engineering required to protect them. Let's isolate trypsin and bromelain to see exactly what needs protecting. Pharmacologists classify both of these active ingredients as proteolytic enzymes. When these enzymes encounter a complex protein chain, they actively bind and catalyze a reaction that cleaves it into smaller peptide fragments. Inside the gastrointestinal tract, this rapid protein cleaving action accelerates the breakdown of heavy meals, directly resolving indigestion. But when these enzymes reach the systemic circulation, they apply that exact same cleaving mechanism to the dense inflammatory proteins accumulating around localized sites of tissue damage. These proteolytic enzymes serve as the chemical engine of the drug, actively clearing out both unabsorbed dietary proteins and localized inflammatory debris. That leaves the third ingredient in the formulation, the 100 milligrams of rudoside. Unlike the enzymes, rudoside is a plant-derived flavonoid with a distinctly different structural makeup. Its primary biological role is to act as a highly potent antioxidant. When tissue is swollen or inflamed, it attracts environmental toxins and generates oxidative stress, which further damages the surrounding cells. Rudoside structurally intervenes at these vulnerable sites, binding to and neutralizing those toxins before they can degrade the fragile cell walls. This creates a precise synergy. While trypsin and bromelain clear out the accumulated inflammatory debris, rudoside establishes a cellular shield, preventing further toxin-induced damage to the underlying tissue. The clinical challenge is delivering this three-part biochemical payload fully intact into the systemic bloodstream. Imagine a standard, unengineered pill containing these exact three ingredients traveling down a patient's esophagus. The moment that standard pill drops into the stomach, it hits a highly acidic gastric pool and rapidly dissolves into raw particles. As these raw enzymes hit the stomach fluid, the severe acid immediately unravels their sensitive structures, chemically denaturing them. Without mechanical intervention, this chemical payload is rendered biologically useless before absorption can even begin. To successfully bypass this destructive environment, Sun Pharma relies on a specific mechanical engineering solution, the enteric coating. The core chemical property of an enteric shell is that it is formulated to remain completely insoluble when exposed to highly acidic environments. As the Flogam tablet sits in the stomach, its physical exterior remains perfectly intact, completely shielding the sensitive enzymes packed inside. It only reacts when it exits the stomach and enters the small intestine, where the environmental pH shifts dramatically from severe acid to alkaline. The enteric coating mechanically responds to this new alkaline environment by finally dissolving, releasing the trypsin, bromelain, and rudoside directly through the intestinal wall and into the bloodstream. This is also why the tablet is engineered to be notably small. The sizing allows the patient to swallow it easily without biting or chewing, which would compromise the protective shell. Bypassing the stomach is a mandatory requirement. By delaying the release until the small intestine, the drug achieves its target site for maximum systemic bioavailability. Because of this specific absorption pathway, standard clinical protocols dictate dosing this formulation twice daily. Crucially, the tablet must be taken directly after meals to ensure the digestive environment is optimized for efficacy. While effective, these active compounds are highly potent and biologically specific, which requires careful adherence to the safety profile. The most immediate absolute contraindication is a known hypersensitivity to trypsin. If a patient is allergic, the medication must be avoided entirely. That strict warning extends individually to bromelain and rudeside as well. A reaction to any single component in the payload precludes its use. Precise post-meal dosing and strict adherence to these individual allergy warnings are mandatory, simply because of the highly specialized biochemical nature of the formulation. Flogam operates at the intersection of biochemistry and physical engineering. Clinicians utilize it to drive two distinct outcomes: resolving localized inflammatory swelling and assisting in the breakdown of dietary proteins. But those clinical outcomes are entirely dependent on the survival of the sensitive proteolytic enzymes and antioxidants during their transit through the body. The tablet is a highly engineered delivery mechanism explicitly designed to solve the biological problem of oral enzyme degradation. Owing to this complex biological action, this specific pharmacological tool must always be utilized under appropriate medical supervision.